Welcome back. It's estimated 4 million Americans have undergone laser vision correction. Most patients are usually happy with the outcome, but maybe about 3% do have some visual problems. Now, a new eye treatment recently approved by the FDA could reduce the numbers of unsatisfied patients. A new laser vision method that customizes treatment for each individual patient. What is it? How does it work? Is this the new deal? Here to explain this new technology is Dr. Brent Reed of Griffin and Reed Eyecare. Dr. Reed, always nice to have you here on the program.
Thank you, Walt.
What's the new thing?
The new thing is a customized treatment. They call it custom view or wave print treatment. And basically what it does is measure about 25 times more accurately than we currently or previously have been able to measure the ability of the eye's ability to bend light.
Okay.
And so we can get a more precise measurement, and it seems to help in a lot of cases to make people see better.
Now, I think we have a graphic which we're going to put up on the screen here for a moment. Some people who do have a problem, and sometimes it's starburst and glare, maybe some night vision problems. What will this new treatment do for those people?
Well, in the study that was completed recently before FDA approval, it showed that about 4 times more people were satisfied with the quality of their night vision with the new treatment than with the older methodology. The graphic that you just saw was a customized ability of the laser itself to grind an image of a Lincoln head penny, which the complex shapes and dimensions of that are incredible compared to what we've been able to even look at before.
When people come in for the laser surgery, and certainly the seminars prior to, is it possible, I mean, most people want better vision. 20/20 would be great. Is there a possibility of getting better than 20/20?
There is, actually, and about 5 to 10% of the population can actually see better than that to begin with, fully or best corrected. But in the recent study that was completed, about 68% saw better than 2016 or better 6 months after the newer laser correction.
Now, what about, is this available, this new thing available for people, all people with eye problems?
It is, but it's available on a limited basis. As far as the power range goes currently, mostly lower powered, nearsighted, and or astigmatic patients are eligible, but the criteria will expand, and the ability to do it for a broader range of patients will increase with time.
So you do have people who do come to the seminars and they really would like to have the laser vision, and some people you just have to tell them, you know, we just can't do it for you. You are a certain type where this just isn't going to work.
Exactly. I just told a man this morning that very story. In fact, he wasn't a good candidate. It wasn't a good thing for him, so told him not to do it.
And most doctors would be, hopefully, that honest instead of taking their ×2.
I would hope so. And I would tell patients that it's very important that you meet with the doctor that's going to do your surgery.
How will this add to the cost of the procedure? I mean, normally, I guess the standard rate, some $2,000 per eye with a lot of people. How much more would this be?
Well, across the country, what's been happening now is the rate has gone up between $400 to $1,000 per eye because of the increased costs involved with the equipment that measures the eye in a different way, and also the technician time, as well as the laser company is going to charge more for their royalty fee.
Oh, sure, absolutely. That always happens. Now, with the new technology, what would be any downsides to this? I mean, it seems like everything keeps getting more progressive and more advances in this field.
Basically, it's a very positive advance in most ways. There really are very few downsides. It's going to allow us, however, to screen some people that we've been unable to screen adequately before, and maybe include them in the laser vision correction where they haven't been inclusive before. Okay,
Dr. Reed, always nice to have you here. I'm sure you'll be along next month with another update on some advancement that's going on in this laser correction field. I remember when Visex was so big and kind of the new thing 10, 12 years ago, and now that seems almost, we're waiting for the next big thing. Doctor, thank you. Always nice to have you. Back with a final check of top stories, weather, and Wall Street after this.